So I am Dr Laurencie. I am a soft tissue specialist surgeon at VSOS, and today we have the little Romeo, an 8-year-old Cavalier King Charles, who is coming for a mitral repair surgery. Mitral valve disease is by far the most common cardiac disease in dogs. So about 1/3 of dogs with mitral disease will have severe mitral valve regurgitation, leading to clinical signs. And with medical management alone, dogs suffering from severe mitral regurgitation will only have a survival time of 12 months. So the heart has 4 chambers, 2 atrium, 2 ventricle. So the left ventricle is the main pumping chamber of the heart. When it ejects, the mitral valve prevents the backflow from the left ventricle into the left atrium, but when the mitral valve fails to work properly, there is regurgitation of blood into the left atrium. So when the regurgitation is severe, the pressure and the volume in that left atrium gets too high, resulting in congestive heart failure, and some fluid builds into the lungs. So that's what we call pulmonary edema. So the common clinical signs associated with congestive heart failure include short of breath, exercise intolerance, cough, lethargy, syncope. So mitral valve repair is the gold standard treatment for mitral valve disease in human medicine, but due to its limited availability in veterinary medicine, most of the dogs with severe mitral valve regurgitation are under palliative medical treatment. So the aim of the surgery is to restore proper mitral valve closure and abolish mitral regurgitation. During a surgery, the left side of the chest will be clipped to access the left side of the heart. Because the mitral valve is located inside of the heart needs to stop beating for the valve to be repaired. So the blood is recirculated externally through a heart-lung machine. So the heart-lung machine oxygenates and recirculates the blood while the heart is open and the mitral valve is repaired. And the mitral repair itself consists of annuloplasty and chordal repair using artificial chordae.
I'm Karina Graham, one of the owners and directors here at Veterinary Specialists of Sydney, and very pleased to say that little Romeo's gone home after a very successful mitral valve repair procedure. This is an open heart procedure that his little heart had to be stopped. All his blood went on a bypass machine, and this was facilitated by a phenomenal team from the Jasmine Clinic in Japan who came over, and also our wonderful Laurencie Brunel, Mariko Yada and Ines Wise, as well as the team of nurses and critical care that watch them around the clock. Very, very pleased to see little Romeo go home happy. And we've also got some exciting news that we're introducing a new minimally invasive procedure, potentially that might suit other candidates for heart disease. So it's called a transcatheter edge-to-edge repair procedure. Not all cases are going to be suitable for that one. Maybe they're more suitable for open heart, but the best news is we've got it all happening here, and I'm happy to look after you.